County Farm Bureaus, we're here to give you a quick update on where we are on the health plan effort. First, thank you very much for engaging and weighing in and helping us get the bill or bills, depending on if you were watching. We had 3 different bill numbers, but to get that product through both chambers of the legislature and across the governor's desk. As many of you know, she let the bill become law without her signature on April 19th, and we're excited about that. Since that effective date or effective action by her puts us into law, we've begun moving forward on the effort to build the plans and to build the offering that we'll make to you, our members across Kansas. The products that we'll be launching this fall include a Medicare supplement plan for those who are 65 and older who need those products. There will be 4 different options available there, and if you're familiar with those letters, they'll be corresponding to what's currently available on the marketplace in those categories. We'll offer a dental vision bundle, which is a product that lots of folks find attractive if their current health insurance doesn't offer that product, or if they just need something to add on to existing coverage. We'll do a short-term plan which allows folks to bridge coverage if they're between jobs or if they're just trying to get from one period of time to another in their healthcare needs. We'll have those products available as well. And then the largest one, which is the biggest undertaking and the reason for the legislation that we ask y'all to weigh in on, is this traditional membership health plan that we'll offer. There will be a couple of options there. Obviously within those there'll be individual plans and family plans, so you can either as a single individual coverage or you can cover your family with the products. Those products will require an underwriting process that should take about 3 weeks to complete. You can begin that process with your Farm Bureau Financial Services agent if you have one, or by going to an online website and doing the process there, or the third way is by calling a 1-800 number and working with a customer service agent who will be able to help walk you through that process and collect the information that you'll need to submit to them. That underwriting process will be built upon your individual health history, so we'll ask questions related to your personal condition and factor that into the plan or the policy that we might offer you for coverage going forward. So when you come to us in September, the first thing that you'll need is Kansas Farm Bureau membership. So we'll hope that is effective and up to date and paid in full for the next year. You'll need that membership number, and then that'll allow you to begin the application process for coverage. Once that underwriting process is complete, we'll be ready, and we've extended an offer for coverage to you. We'll be ready to begin having those contracts be effective in January, on January 1st of 2020. So what the system will look like at that point is very similar to what folks who have current health coverages will look like today. You'll get a card. There will be a network of doctors and clinics and hospitals and specialists that you'll have access to because of and with that card. Some products will have co-pays or doctor visit fees associated with them. You'll use that same card to access prescription drug benefits as well. So all of those things will key off of that contract for coverage and the card that you'll get with the health plan coverage that you purchase from Kansas Farm Bureau. So we're excited to be able to bring that to you all. We have a couple of partners that I think it's important to talk about as well in this process. So first, in the design and development of the plans, we're partnering with one of the Tennessee Farm Bureau companies. These are the folks who have been writing these kinds of plans for their members for nearly 70 years in Tennessee and have a lot of experience in understanding the needs of rural Americans, rural Kansans, and offering products to meet those needs, and specifically to meet the needs of our farmer and rancher members across the state. We'll also partner with United Healthcare, or the UMR subsidiary of United Healthcare, which is the network provider. So those are the folks that will offer the contracts with doctors' offices and physicians and pharmacies and hospitals across the state and beyond. Our thought process in picking United Healthcare was to make sure that the network was broad and available to folks regardless of where you live in Kansas or where you receive care, whether that's in Kansas or outside of the state. Once we're up and running, you'll be able to go to the website that has the applications for the plans on it and put in your zip code and other information. That will tell you all of the doctors and clinics available in your area for coverages under those plans. So you'll be able to get fully informed about what we offer once we're up and running. And if you want to follow along our progress as we're building this out over the next several months, you can go to kfb.org facebook.com/KS Health Plans. We'll chronicle the story, and once we have new information about what plans will be available or how those will look, we'll post them there. And always, we're happy to take whatever questions you have and try to keep you informed as we move forward. We hope you're excited about this as we are. We think it's a great opportunity for not only Kansas Farm Bureau to provide a valuable service to our members, but also for rural Kansas and our opportunity to meet the needs of folks across the state.